Okay, welcome back everyone to the Upper Cervical Chiropractic Research Show. This is episode 24, and on behalf of the Council on Upper Cervical, I'm Dr. Kevin Leach, and here with me once again is my good friend Dr. Tyler Evans. How are you, sir?
Good to see you.
Good to see you. All right, so today's episode of the research is titled Cervicogenic Headaches, a Critical Review by Scott Haldeman and Simon Dagenais. Dagenais, is it French? I don't know. Sorry, Simon. Published in the Spine Journal. And so the goal of this paper, obviously, was just to do a complete review of all the published literature on cervicogenic headaches, including all types of treatments and all professions available. Maybe not all, but many of them. But ultimately to spread, I think that the idea is ultimately to spread the awareness of the fact that a significant number of headaches can originate from the neck. And that's, one of the reasons why, at least from a chiropractic standpoint, that upper cervical and traditional chiropractic both have gotten fantastic results on headaches. So it's a long paper. Dr. Evans, you told me, you suggested to do this paper. So what are your thoughts, just kind of, 50,000 foot on why you wanted to do this and why this paper is valuable?
Yeah, well, I think that this paper is older. It's about 20 years old. It was written by a gentleman by the name of Scott Haldeman, who is one of the foremost researchers in chiropractic. He was or is still, not sure, a member of the WFC, the World Federation of Chiropractic or Chiropractors, on research. So he has been around for a while. He graduated from Palmer in 1964, and right after Dr. B.J. Palmer's death in 1961, and really pushed for a more research, evidence-based model within chiropractic. And I think he made a big dent in that world. And this paper is one of his big, I think, achievements in his career. And we were talking before about trigeminal neuralgia. We were talking about how trigeminal neuralgia might come about and how the neck might be related. And this paper, albeit very briefly, discusses that mechanism and some of the other parts to that mechanism. And I think it's just a great paper. It's really well done.
Yeah, agreed. And we used one of the illustrations from the paper on one of these past episodes that we did, which kind of breaks that down. Let's go in this direction. Just for the people that are watching, before we get into any sort of detail about neurology and things like that, let's just focus on, for any of the patients that are watching or somebody that's maybe run across this instead of the doctors, of like, why is this paper significant to them if they have headaches or if they have family, with headaches or a loved one? Why is this important for them?
Yeah, and then that's the big one thing that I kind of skipped over there. But this paper talks about cervicogenic headaches, a critical review. And the whole point is that, so when you look at the pyramid of research and evidence within the peer-reviewed literature area, we talk about case studies at the bottom, and then we kind of work our way up. We got randomized controlled trials, and then a review of the literature, review of randomized controlled trials. Those are at the very top of the pyramid. So this paper would be the kind of cherry on the cake of cervicogenic headache information within the manipulative world, which is what this paper was sort of designed to show up as. So if you have headaches, if you have chronic head and neck pain, this paper is a great review of the methods, the history of that problem, how it might occur, and ways to treat it. And so Scott Haldeman, being a chiropractor as well as a medical doctor, he graduated in 1964 from chiropractic college, but then went on to become a medical doctor and a researcher. He has a perspective on manual manipulation and spinal manipulative therapy. And in this paper, it shows, or he talks about how it's not the only solution, but it seems to be the most reviewed and best represented treatment option out there in terms of getting some results. It doesn't say the results aren't conclusive, and it doesn't say, oh yeah, absolutely 100%, you know, that's the only thing to do. But definitely in terms of like surgery, injections, medications, spinal manipulative therapy for cervicogenic headaches
Meaning
seems to
from the
be,
neck,
meaning from the
originating
neck,
from the
sorry,
neck.
yeah,
Right.
from the neck.
Yep.
So yeah, and the vertebra of the neck, there's 7 vertebra in the neck. We have muscles, ligaments, and tendons that attach around, and then go nerves that go up into the head from the neck. And so we're discussing how those structures could then cause head pain, and why getting the neck adjusted might reduce that pain or help with that pain.
Right. And so from a conservative standpoint, right, it goes over a lot of the different ways to treat that, but it says and again, not conclusive and not 100% of the time, obviously, but a significant amount of people get help from the conservative standpoint of the manipulation or chiropractic adjustment. Very similar, not the same, but very similar, which is a huge finding and a huge takeaway in a study like this.
Yes. Yeah, and we get into, you and I quite a bit, talk about the craniocervical junction or the upper cervical spine. And in this paper, it doesn't talk necessarily specifically just about that. It does talk about the lower cervical spine degeneration being a part of the problem. And as you and I both know, the joints that wear and tear the most when it comes to degeneration with discs and arthritis tend to be those C5, C6, C7 joints. That has to do with more of the physics of how the head weight is placed on the shoulders and the neck. But biomechanically, if you want to correct a problem in the cervical spine and get that weight placed more evenly back over the shoulders, we talk about correcting the craniocervical junction of the upper cervical spine, the top 2 vertebrae right up here, and how that would impact lower down. Dr. Haldeman is not an upper cervical chiropractor and is more of a general chiropractor. So he's talking about the whole neck. But when we talk about the upper cervical spine, we have nearly 50% of range of motion coming from C0, C1, C2. You know, that area is the most dynamic area in the spine. So if there's a problem in the neck, correcting the upper cervical spine is going to be a really good place to start from. Although that isn't the direction of this paper, you can take the results of it and you can kind of establish that as that's where we're coming from.
Right. That's a good clarification. It's not an upper cervical chiropractic study, but we're looking at it from an upper cervical standpoint. And obviously from the illustration on page 7 with the distribution of the C1, you know, the first nerve through third nerves and all of the different, just from the trigeminal nerve and all the input there, and then from the distribution of the spinal nerves, everything going into that trigeminal nucleus and what can happen with that. But again, it's not to say that things happening from below the upper neck can't cause that as well. But it seems as though that probably a lot of it, or a significant portion of it, is most likely coming from the upper neck, but not everything, but not all of it. And it's, you know, another interesting point here is in the paper, almost like every research paper says, they say in the conclusion that, you know, the results aren't conclusive, we need more research, et cetera. Like it always says that. And it's one of the other points that it says is, there remains considerable controversy and confusion on all matters pertaining to the topic of CGH, which is cervicogenic headache. And, you know, when I was reading this and I was reviewing it and I was thinking about that, you know, it talks about the difficulty in the diagnosis and how most of the symptoms overlap with migraine headache and tension type headaches, and how differential diagnosis is difficult, and that almost every single structure in the cervical spine has been blamed for causing these headaches. And, you know, I think it's going to be a tough road for research to really nail this down because of all of the different structures that could be potentially causing it, which we're getting into that approach of 1 + 1 = 2. This caused this, instead of looking at it like a dynamic, like the paradigm that we look at it from, like a holistic paradigm. Like if there's something wrong with the upper neck and we believe it's causing a headache, I mean, most patients are going to be different. We're never going to have the same set of data from different patients with the exact thing going on. And if all these different things are implicated in potentially causing them, then instead of actually just trying to figure out which one it is and treating that, we just analyze the neck to see what's actually wrong and fix it as much as we possibly can and restore the body's ability to just heal and function properly. And then let the body do its healing instead of really trying to be focused on, well, what's actually causing it? Is it the C2 left facet that's causing? Well, I mean, why don't we just analyze the whole spine and correct it and then just allow the body to heal? So, that's one of the things in chiropractic, there's always a little bit of argument inside the profession about, treating symptoms and not treating symptoms. And it's, focusing on, maybe getting headaches better because that's why the patient came in, instead of just treating their spine and removing the chiropractic subluxations and letting them get better. But it all comes full circle, because it's all, just if we just focus on correcting what's wrong with the spine, then things should get better. And if something is causing the headaches, then it's a matter of finding out what the cause is. And if there's something wrong with the spine, let's correct the spine and watch the body heal. And if it's something else that's more severe or something else, then we can triage and we can refer out to other doctors. I think, but I guess what I'm trying to say here is that research papers like this that, kind of at the end are like, oh, we can't make any conclusions. It's like, well, there's still evidence and there's still a suggestion of like, hey, like the neck is a big deal with headaches. So the way we look at it is, well, instead of trying to figure out if it happened, let's just figure out if there's something wrong with the neck and fix it, and then see if it, removes the headaches. We know all the benefits that it's going to happen by treating the neck anyway. So let's just do that. Hopefully the headaches get better if that's why the patient came in, and their, overall quality of health is going to be better as well.
Yeah. And the only treatment approach supported by a reasonable body of controlled trials is cervical manipulation. And it does say this is by no means conclusive, but this is Scott Haldeman's way of saying, get your neck adjusted. And it's in the peer-reviewed literature, and it is a review, which is the top of the pyramid. It's better than randomized controlled trials, right? So this is a review of basically the last 100 years of research. The beginning of this paper, it states that back in 1860 to 1862, a gentleman by the last name of Hilton, who was probably a medical doctor because chiropractors didn't exist. And I think that even AT still and osteopathy weren't even really around yet until 1865, if I'm correct. So had to be a medical doctor. They've been talking about, within the medical profession, they've been talking about the fact that headaches that present in this pattern are more than likely related to problems coming from the neck. And just a couple of quick facts so that we can kind of roll through this. So for people who are interested in why this might be happening, in the first paragraph of the paper, I think it's the first paragraph or second paragraph of the paper, it says the problem of headaches related to the cervical spine cannot be underestimated. Up to 80% of patients with cervical acceleration, deceleration injuries report headaches within 2 months of injury. Almost 25% of patients with this form of injury continue to have significant neck pain 2 years later, with the majority also complaining of headaches. So, this is a good outline of like, okay, this is why the neck is so important to get checked. If you've had an injury, especially car accidents, that's those whiplash associated disorders, and you take and you line up post-concussion syndrome, whiplash associated disorders, craniocervical syndrome, you put all these things together, they're all kind of similar. They have similar injuries at similar places, not the same thing. And I'm not saying they're all the same thing, because they're all very different, but taking care of the neck, which is what Dr. Leach and myself, Dr. Evans, we do on a daily basis. We really work with the top two bones in the cervical spine. But in doing that, it can help so many different things just by doing a really good job of correcting very conservatively, gently, specifically with good imaging and good procedures. That's what we're working on.
Yeah, I think a good perspective too is the paper talks about, again, they talk about injections, they talk about surgery, they talk about all kinds of different things. And, I think for the people that might be skeptical just about chiropractic or just something like this that could potentially be helping them anyway, if you do have more faith or whatever belief in the medical profession, to understand that this has been happening since 1860, that medical doctors have been looking at this, and also in current healthcare, there are clinics, there are headache clinics, there are doctors. The medical profession is treating the neck in their way with injections or surgery, or drugs, to help people's headaches. So like, there's no doubt that that you could be having headaches from the cervical spine. The medical profession has obviously, agreed with this. There are clinics that are literally dedicated to like injections, for people's headaches, and they go into the neck. So now the question is, if you want a more conservative approach, instead of just treating the symptoms and hopefully just numbing the pain or just influencing the nerves with whatever they're going to inject, chiropractic is a perfect alternative or first approach, a conservative approach to potentially helping your headaches without having to do a more invasive procedure. I mean, they're very,
possibly more effective.
And what seems to be in the research to suggest that it's actually more effective.
Right?
So
the only treatment approach supported by a reasonable body of controlled trials is cervical manipulation.
Right.
Right. Quote of the paper.
Right. So that's huge to understand. I mean, let's not beat a dead horse, but it's, get checked, and again, it's get your.
And it's big. This paper is a big paper. It was done 20 years ago. So it is old, but it's done really well. And they haven't repeated a paper of this size and importance since. And just in terms of like the pathogenesis of what might be going on, we've talked about it before, but I'll just run through it real quickly. It just talks about how one theory of CGH etiology comes from anatomical studies showing an attachment of the suboccipital, so the muscles at the back of the skull, right over C1 and C2 tissues, to the dura mater, which is literally along the spinal cord. There is a little shield that runs along the outside. It's a protective layer of tissue around the outside of the spinal cord. But there are muscles that actually, the dura mater attaches through the craniocervical junction, which is right where we work, that upper cervical spine, into the spinal cord. And it says, and the observation that mechanical traction on these tissues of misalignment of the vertebra can cause movement of the dura. So it's literally bones are out of alignment. And we're talking this, they're actually discussing the craniocervical junction, C1 and C2 up here. Misalignment on these tissues can cause movement of the dura. The rectus capitis posterior minor muscle and the ligamentum nuchae, they're all ligaments and muscles right up here, have been shown to have direct connections to the suboccipital dura on a very delicate dissection in a small number of cadavers. This suggests a role of the dura as a nociceptive structure. And then it goes into as well, what does it say? Structures implicated in the genesis of CGH all have their sensory innervations through the upper cervical, and that's where that trigeminal picture can come in and play. Mid-cervical nerve roots, which lead to the cervical cord and converge within the spinal tract of the trigeminal nucleus. And that's that kind of model we were talking about. But that's how that's how what we do could be helping. You correct C1 and C2, and you take that tension, you take that cord tension out, you balance those muscles, and it reduces that afferent drive up into the trigeminal nucleus that's causing an overload of sensation, nociception up there.
Absolutely. I think another point to make as well is that, and I don't think we mentioned this yet, but the differential diagnosis between between the migraine headaches, the tension type headaches, and then a cervicogenic headache. A lot of these things, again, the literature, what they found is a lot of these things are overlapping. So it's really, and it makes sense because the body is so dynamic and so intricate that if there's a problem or an injury in the neck, it's not just going to just affect one tiny little thing, we don't know. Obviously there's a lot of overlap of where the different symptoms can happen, if it's unilateral, if it's just in the back, if it's in the there's all kinds of different things that can happen. So again, it's differential diagnosis is important to an extent, but if you just get somebody who really knows the neck and can just analyze the entire neck, correct it and treat it and allow your body to heal over time, then you'll start to see how much of that stuff is related to the neck and the injury.
Yeah.
The point that I thought was interesting that I highlighted here, it's on page 8. It looks like it's the second paragraph. Martelletti has reported increased levels of pro-inflammatory cytokines, et cetera, et cetera. It was just saying that it didn't really see a connection between inflammation in the joints and headache, which I thought was super interesting that would be the case. So hopefully they do some more research on that in the future, because I'm pretty sure Chestnut actually goes over that inflammatory type response in the joint. Inflammation irritates the nerves, causes nociception, causes pain, right? So I think that's a very general idea, but I think somewhere in the paper here it said that finding wasn't supported.
Inflammation is what you're talking about specifically. Inflammation in a facet joint. I could see how that would cause facet pain, which might show up in a dermatome, but not necessarily in head pain. Whereas we're talking about more of a neurogenic type pain, where I can see spinal cord tension as a possible hypothesis for that, or trigeminal nucleus pain as a hypothesis for that. But yeah, I mean, I can see how that might be more of a facet pain situation, or a specific area down lower.
What about the disafferentation part of that? Would that still be?
Well, I think, yeah, I mean, that's complicated. It really depends on the paper, right? So it depends on who did the research, how well their research was done. Yeah, I don't know.
Just to go back to a different point, because in the paper it talks about degeneration being a potential problem as well. And it's not something that's talked about a lot, but we know that injury to the spine leads to that degeneration process because of abnormal biomechanics, et cetera. And so back to the holistic, vitalistic approach of chiropractic and not treating symptoms is when people have injuries, they really need to have that taken care of, because slowly over time, the spine's going to break down.
Yep.
And again, the medical profession is going to say that it's just a normal aging process, when we know that that's not true. We see the cervical spine, we see the top discs are healthy, and then maybe 2 discs down below are not. And it's they're the same age. So there has to be a different reason why they're degenerating.
Yeah, and I think there's multiple pieces to that. I think one piece would be getting checked from birth,
of course,
right? Because we know that trauma starts at birth. A lot of times it then continues on as we start to walk and crawl and play sports and learn to drive and have car accidents and sit at a desk all day working on Zoom, and so it's just that part of it, the trauma piece of it. But also, I don't think back in the early 1900s, it was nearly as much of a problem as it is today, but inflammatory gut issues that then go into the bloodstream through leaky gut and then attack the spine because it's the largest joint, areas in the, but one of the largest joint areas right directly behind the digestive system. And digestive problems, inflammation then attacks the spine, and you layer the American diet with trauma, which I've seen. I've x-rayed people from other countries. Like I had a patient that was from Argentina, and she came in, she was in her 80s. She had just developed some hip pain at like 83, I think, never had pain in her life. I took an x-ray of her neck and I was like, holy cow, because we were doing upper cervical care, even though she had hip pain. She cleared out after one adjustment. She never needed to adjust that again at 83 years old, because she lived a healthy life. She ate well, and, she exercised. She didn't have trauma to her spine, and we got her adjusted. She had little to no arthritis at 83 years old, in a perfect C-shaped curve of like 30 to 40 degrees. And I was like, that's amazing. So anyways, back to the topic is just that, yeah, you're right. A conservative approach is lacking in most areas and means of helping the body heal. And this is what we're preaching here today.
Right. And, just chiropractic as a intelligent, conservative healthcare lifestyle choice
Solution.
is beneficial. You're going to go to the dentist for the rest of your life and get checked and fixed and all that when necessary. Like, that's just for your teeth. So why not do that for your spine?
Absolutely.
Yeah.
Absolutely.
Yeah. So what else, anything else with the paper? Any other points?
Yeah. I love the fun fact that Scott Haldeman is part of the family of one of the longest running chiropractic families that exists. I'll just read the quote out of chiropractic, chiro.org. So it's Dr. Scott Haldeman is a board certified neurologist, active practice in Santa Ana, California, is a chiropractor, researcher, and a family member of his, accomplished in his own right, Dr. Haldeman happens to be the uncle of one of the world's greatest innovators, Elon Musk, who, Musk is the son of the brother of Dr. Haldeman, or he's his uncle, right? So Dr. Haldeman is his uncle, and Scott's father and his grandmother, Dr. Haldeman, Scott Haldeman's grandmother, was the first chiropractor known in Canada in the early 1900s. And so their family lineage of chiropractic goes back really far. Andy's,
very cool.
Elon Musk's uncle. I think that's lots of fun. That's fun to talk about because I like to follow Elon, find him interesting.
That's cool. That's cool. Well, I don't have a fun question for the day, so maybe we'll just for Dr. Evans. So we'll make it the Elon Musk fun fact.
Yes.
Awesome. Well, so just for anybody interested in just learning more about the Council on Upper Cervical, ICAuppercervical.com is the website. There's for the doctors out there, anybody interested, you want to say just a word about Nashville coming up?
Oh, yeah. So we will be having, and this podcast may go out much later. You'll probably be listening to it maybe years down the road, but we try to have once every year or once every other year an ICA Upper Cervical Council, a Council on Upper Cervical Care symposium on the newest research, what's happening out there in the profession. I'll actually be presenting on the latest advances and achievements in cone beam CT in the last year. This will be in Nashville, August 13th and 14th of 2021. And we will be having a great time. Come on out, get registered. If you're an upper cervical chiropractor, we'd love to see you there. And this is just a great place to come and learn what's happening in our profession.
Fantastic. All right, Doc. Well, thank you as always for your time, and we'll see you on the next show.
Awesome. Thanks.
Right. Okay, that's it for this episode. So what did you learn that fascinated you or surprised you about the research today? Join or start the conversation in the comments below. Hey, thanks so much for watching. To watch more of our research shows, click or tap the screen right there. To subscribe to the channel, click or tap the screen right there. Until next time, I'm Dr. Kevin Leach with the Upper Cervical Chiropractic Research Show, bringing awareness to conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic. Until next time, take care and take care of your spine. It's the only one you'll ever have.